Hello and welcome to the Narcan Nasal Spray for Law Enforcement Training Module, brought to you by Adapt Pharma. The goal and purpose of this training module is to provide law enforcement with the necessary information to identify, assess, and treat individuals experiencing a potential opioid overdose with Narcan Nasal Spray. Narcan Nasal Spray is a prescription medication used for the treatment of an opioid emergency, such as an overdose or a possible opioid overdose with signs of breathing problems and severe sleepiness or not being able to respond. Narcan Nasal Spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan Nasal Spray, even if the person wakes up. Narcan Nasal Spray is safe and effective in children for known or suspected opioid overdose. In the United States, someone dies from an opioid overdose every 21 minutes. These deaths have no boundaries. From the wealthy to the poor, pediatrics to geriatrics, in small towns and big cities, the opioid overdose epidemic continues to take more and more lives. Immediate emergency action is essential on the front lines of this battle against opioid overdose deaths. Opioid overdose has officially become the leading cause of accidental death in the United States. The Centers for Disease Control and Prevention has concluded that Americans are more likely to die from an opioid overdose than a car crash. The stereotype of opioid-related deaths affecting only heroin users is unfounded. Opioids are available in a variety of forms, from illicit drugs to prescription medications. As a country, the United States is the single largest consumer of prescription opioids in the entire world. An astonishing 260 million opioid prescriptions were filled in 2015. A disturbing trend is the increasing abuse of these prescriptions in rural America. This massive quantity of legal opioids, coupled with the illegal opioids, such as heroin, has led to the epidemic that we're facing today. As a law enforcement officer, you play a major role in the battle against the opioid overdose epidemic. During this presentation, you will learn how to use Narcan Nasal Spray when indicated, as well as understand the important safety information. The appropriate use of Narcan Nasal Spray may help law enforcement officers reverse the effects of a known or suspected opioid overdose. However, Narcan Nasal Spray is not a substitute for emergency medical care. The Quick Start Guide can be found in the Narcan Nasal Spray packaging. Consider becoming familiar with the Quick Start Guide, patient information, and instructions for use before an opioid emergency happens. If you encounter someone who is unresponsive and you suspect an opioid overdose, first shout their name
are you
if
okay?
known.
Mike, are you okay?
Ask if he or she is okay. Rub firmly in the middle of their chest to see if they wake up. Then check for signs of an opioid overdose. These include unresponsive to touch or voice, breathing that is slow or shallow or has stopped. Check for pinpoint pupils, fingernails or lips that are blue or purple. Lay the person on their back to receive a dose of Narcan Nasal Spray. Administer Narcan Nasal Spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Narcan Nasal Spray has no effect in people that are not taking opioids. Remove Narcan Nasal Spray from the box. Peel back the tab with the circle to open it. Hold the Narcan Nasal Spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Each Narcan Nasal Spray device contains one dose and cannot be reused. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan Nasal Spray. Then, remove the device from the nostril after giving the dose. After you have administered the medication, you should ensure that EMS is responding to the scene of the emergency.
Dispatch from 26, send EMS to my location for an unresponsive patient with a possible opioid overdose.
Remember, Narcan Nasal Spray is not a substitute for emergency medical care. Additional supportive and/or resuscitative measures may be helpful while awaiting emergency medical assistance. Move the person onto their side after giving Narcan Nasal Spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach, which is known as the recovery position. If EMS is not on scene yet, continue to watch the person closely. If they do not wake up or respond to your voice or your touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan Nasal Spray and give another dose in the other nostril. Remember, additional supportive and/or resuscitative measures may be helpful while awaiting emergency medical assistance. Use in patients who are opioid dependent may precipitate opioid withdrawal, characterized by body aches, fever, sweating, runny nose, sneezing, goosebumps, yawning, weakness, shivering or trembling, nervousness, restlessness or irritability, diarrhea, nausea or vomiting, abdominal cramps, increased blood pressure, and increased heart rate. In infants under 4 weeks old who have been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated right away. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all the possible side effects of Narcan nasal spray. When the emergency is over, put the Narcan nasal spray back in its box and dispose of it in a place that is away from the reach of children. Store Narcan nasal spray at room temperature between 59 and 77 degrees Fahrenheit or 15 to 25 degrees Celsius. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children. Now that we've reviewed how to administer Narcan nasal spray, consider becoming familiar with the Quick Start Guide, patient information, and instructions for use before an opioid emergency happens. To report suspected adverse reactions, contact Adapt Pharma Incorporated at 1-844-4NARCAN or 1-844-462-7226 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Thank you for watching the Narcan nasal spray for law enforcement training module, brought to you by Adapt Pharma.